Hi, Dave Butler here. Here at my clinic, Align Therapy, we treat a lot of scoliosis patients. We treat a lot of kyphosis patients, a lot of spinal deformity patients. And I wanted to share today the differences between some of the techniques that are used to treat scoliosis that I get asked in evaluations and by people online. There are multiple schools of treatment for scoliosis, and sometimes it can be confusing because there are some that are more effective than others. There are some that have been around longer than others. And so hopefully I can help to clarify what some of the different methods are. And I want to also describe what I use those methods for my patients, because that might be helpful if you're looking to get treatment, or you have a loved one who's looking to get treatment, that you can know which ones are better for certain types of scoliosis. Don't forget to subscribe to the channel. We really appreciate that, and leave comments. I would love to hear your thoughts on this as well. So if we think about general treatment, conservative treatment for scoliosis, lately there's been a term called Physiotherapeutic Scoliosis Specific Exercise, or PSSE. That's kind of where a lot of the conservative methods for scoliosis treatment are falling under now. So in the research you'll see PSSE, and that isn't one specific method of treating scoliosis. It's kind of an umbrella for multiple conservative ways of treating scoliosis. So keep that in mind. If you see a PSSE, you might have to dig a little bit further to see what actual method they were using. So if we go past PSSE, the most research-backed and the most the longest used scoliosis treatment is the Schroth Method. And the Schroth Method started in 1920, 1930 by Katarina Schroth, but over time it's been changed a little bit and progressed with different methods. So there still is a Schroth school, a German method of Schroth treatment that I believe is only taught in Europe. I think it might be taught occasionally in the US, but that's traditional Schroth from the German school. I can't remember what year it was, but the Barcelona Scoliosis Physical Therapy School, BSPTS, started kind of a branch off of Schroth, and so BSPTS is Schroth-based exercise, but that's having a transition lately too with Manuel Rigo. He's changing things enough that he's creating his own the Rigo concept of treating scoliosis. So you might see that in the literature as well. So we have the Schroth Method, we have BSPTS, you'll probably hear about Rigo concept for scoliosis, and then we also have the SES approach, the scientific exercise approach to scoliosis, that is from Italy. So it's an Italian method that is from Issaco, and that's probably the second most research-backed conservative scoliosis treatment. So that gives you kind of a rough history. We have, well, a rough list. We have Schroth, we have the German school, we have BSPTS, we have the Rigo concept, and then we have the SES approach, or scientific exercise approach to scoliosis. BSPTS had a branch that came off that is SSOL, so Scoliosis Online Learning, that was started by Hagit Berdyshevsky in New York, so that's something that's out there as well, but that is under the Schroth umbrella. So it gets kind of confusing, but hopefully that was helpful to kind of connect the dots. So now, for what do I use those methods for? Because I'm trained in the SES approach, and I'm trained by BSPTS, and I have therapists that are trained by SSOL. So what do I use those for? BSPTS and SSOL are very similar. SSOL was a branch off of BSPTS, so it's basically the Schroth Method. For Schroth Method, those are my adult patients. I use the Schroth Method for that, for those patients. For my adolescent patients who have a little more ability to think through their exercises, I will definitely use the Schroth Method because it's been most researched and shown to be effective for that. For the SES approach, my younger patients who struggle with being able to connect the dots and really think through the exercises. Just because they haven't matured to that point yet, I will definitely use the C's approach with them. Also, for my patients who are struggling to be able to do the exercises consistently because they're busy, I will definitely use the C's approach to give them something that they can do that's simpler, that's not, it doesn't take as much specific equipment and exercise time and stuff like that. So there are other methods for scoliosis. There's the lion method, there's the side shift, there's the Doberman method. So there are a lot of other ones, but the main ones, hopefully that helps you to understand what those are. None of them are bad. I think if you have a specific approach to treating scoliosis, it's fantastic. In PT school, we don't get that. So if you're treating someone who hasn't been trained in any method and is just winging it with their PT education, then that's probably something that you want to consider going with someone who is trained. And definitely look at someone who is certified in the method that you're looking to do. I have videos that demonstrate the C's approach. I have videos that demonstrate the Schroth Method. So if you're looking for those videos, I'll put links in the description so you can check those out and make sure that they're right for you. And good luck with your scoliosis treatment. I hope that it goes well. Hopefully this was helpful, and we'll see you next time.